Hi, I'm starting residency tomorrow. Going to just pack a few things and make a list of everything that I should take with me. Going to see if I'm missing on anything. I am a little nervous because I don't know what I'm going to do on my first day, because in medicine I have seen, when I was working as an intern, I have seen that freshly joined JR start with collections and other stuff which we do in our internship also. I don't know what radiologists start with on their first day of residency. I am mentally preparing myself to feel really dumb in case that happens. Yeah, I'll keep you guys updated, or I'll at least try to. I have this new diary which I want to use. I don't know what I'll write in it, but in residency, so whatever I learn which is new, or whatever reflections I have on certain things, I thought I'll write them down in this. Maybe I won't have the time to do all this, but I just want to keep this with me. Hello, good morning. Yesterday was my first day. Most of it was spent like collect documents and submit them to this office, that office, like all that. I am currently posted in routine ultrasound. We had an orientation yesterday where our seniors told us how everything worked, what are the rules, how we are posted in different places within the department, what our duties will be like. Yeah, today is my second day and I'm going to be on call today. What does call mean? It's almost like a 36-hour duty. In the morning, you're working. My work starts at 7:30 a.m. That goes on till whatever time it takes to finish all the patients' scans. And then after that, you are on call. That is, you're doing emergency scans till morning. And then again in the morning at 7:30, you are going back to the routine ultrasound. Yeah, let's see. I'm excited. I enjoy ultrasound. I knew I would enjoy ultrasound even before I started residency. It's going to be fun, and I had fun yesterday. The senior who was teaching me was really sweet, and got to see obstetric ultrasounds like malformation scans, routine scans. So just getting an idea of how reports are written, what exactly you have to look at. Some stuff which I'm writing down in a diary, and if I get time, I'll be reading that from some book or the other. Good morning. It's almost been 1 week since residency started. So far, we are just observing our seniors and learning how to write the reports and the format of those reports, and we're watching our seniors do these scans. I am posted in ultrasound right now. Seniors are teaching us what are the planes when you hold the probe, and in which plane what can be seen, how to get the optimal plane for visualizing a certain body part in a fetus if you're doing obstetric scans. Yeah, it's been fun so far. I have only done one follicular scan so far, which was successful. Apart from that, all the other follicular scans which I've done, I could not visualize the structures really well. There are tips and tricks to that, and I think once I get used to seeing the same thing over and over again, I'll get good at it. We also saw a lot of interesting cases. Got to see the typical hydrated cyst appearance on ultrasound. That was really fun. Being in a government hospital, that is the advantage. Our seniors also keep telling us that the hospital is not amazing because of the machines it has. It's because of the patient load we get and the kind of cases we get to see, which are really rare and difficult to come by if you're in periphery or if you're in a private hospital. Yeah, I'm grateful that I'm getting to see all this. I was very naive in thinking that I am going to get to sit down and get to read about all these cases which I see, but in first year it's not possible. I have quickly realized this. I'm going to just write down everything that I see or everything that our seniors tell us, so that I don't forget it whenever later on in the year or maybe next year, when there is enough time to go through all that and then read something, then I will surely read up on it. Really enjoying routine ultrasound posting so far. I'm going to miss this the next month when I get posted to some other part of the department. Our seniors are really nice and they're teaching us quite a bit. There are times throughout the day when we get shown interesting cases by our faculty. Everyone gets together to discuss what are the findings, what are the small things which you are likely to miss in these cases when you're doing these scans on your own. Granted that we are not, like the first years are not actually doing any scans on our own right now. We are just observing and learning what is normal first, so that once we see something abnormal, we know it is abnormal. Still, I am enjoying every second of ultrasound posting. I can't wait to get posted back here again very soon. Good morning. I'm going to share with you guys an interesting case which we saw. Ectopic pregnancy is when there is implantation of the fertilized ovum outside of the uterine cavity. So that can be anywhere, that is in the fallopian tubes, in the ovaries itself, the abdominal cavity, anywhere outside of your normal uterine cavity. And there is something called as heterotopic pregnancy. At the same time, you have two gestational sacs, that is two fertilized ovums implanted, one inside of the uterine cavity and one outside, that is one of them is ectopic. This is heterotopic pregnancy and it is supposed to be like really rare, and we got to see it the other day. It was so cool, and then we ended up doing like invasive procedure under radiological guidance for the gestational sac which was outside of the uterine cavity. The lady got to avoid a major procedure to have the gestational sac removed, and especially if the patient is an infertility patient, so if you are causing less damage to the tubes, that is increasing their chances of conceiving in the future. That was really cool. I just wanted to share. Hello, the first month of residency is over and I am done with my posting in routine ultrasound, and next I'm moving to emergency ultrasound. So we have two different sections for ultrasound. Emergency ultrasound is where you do USG for all the casualty patients, like the ones who are coming to the emergency surgical room, the emergency medical services, pediatric emergencies, orthopedic emergencies, you name it. I am very happy because I really liked ultrasound. Apparently in emergency ultrasound you get to see a wide variety of interesting cases because most often there are a lot of positive findings, deviations from the normal findings which you get to see in routine ultrasound. So I am pretty excited. This was the first month. I am sure that as I progress further in the residency, as we start getting more responsibilities as first year residents, it's going to get a little more hectic. I tried to film whatever I could to share my experience and to share what it's been like, to just keep you all updated. I hope it wasn't very boring because I know I haven't done a lot of filming in the hospital for obvious reasons. I am there as a trainee and I can't, show off, trying to be respectful of the department and the seniors and the patients. So that's why I'm choosing not to showcase a lot of things which are happening in my daily life, and instead I'm just talking about it and sharing with you guys verbally. So I hope it isn't very boring and still interesting enough. One nice thing about EMS ultrasound is that it's been nice to keep up with the follow-up of patients. Something you saw on ultrasound and then another imaging modality done for that patient to evaluate further. Then you find out something more and something even more definitive. Then you contact those residents, contact the other doctors, you contact the patient, and then you try to find out what was the ultimate diagnosis, what was the ultimate treatment that happened, and if there was some lesion which was taken out, what did it look like post-operatively. Like when you're giving your diagnosis based on ultrasound, whether that was correct. One certain morphological finding on ultrasound can mean two different things, some differentials that open up. It's helpful to expand your knowledge, and most of the NEET PG knowledge is actually useful when it comes to real life scenarios and patient management. Like it's not just bookish knowledge which you are using for exams, except for certain subjects, but then again depends on which branch you end up taking. In the month of September, I was posted in routine ultrasound, which was mostly OPD patients. Most of the time the ultrasounds turn out to be mad, and now I'm posted in EMS ultrasound. So now a lot of patients from the casualty are patients with a lot of positive findings. Most of the times they're also referred from other hospitals, periphery and private clinics in view of some positive findings which have already been detected in the patients. It is really fascinating because first I learned how normal things look like, and now I'm getting to see what the deviations look like, and it has been really good foundation. I think this is going to be really helpful, and needless to say I am enjoying ultrasound posting because there's a lot of patient interaction as well. Sometimes you're doing USG guided procedures, and those are sometimes therapeutic, sometimes diagnostic, and sometimes therapeutic. They are helping in the patient's management as well. So I am really liking ultrasound so far. So let's see how things go when I get shifted to some other modality. today and I just did my first ultrasound guided pleural tap and I'm feeling really happy about it. Hello, it's the last day of the month of October and I am now done with my emergency ultrasound posting. Although I was really enthusiastic over the first 2 months and I was really happy doing ultrasound, now at the end of the 2 months I am a little tired and worn out. I know as a radiology resident I have no right to complain about sleep deprivation or feeling burnt out because the clinical branch residents have it way worse, and I know their working hours are worse and the kind of work they have to do is worse, and I am privileged in that way and I understand that. Still, this is how I'm feeling right now. It's like that feeling that there's nothing to look forward to. I don't know, or maybe it's just that I'm having mood swings. I just wanted to share this to explain that it's not always sunshines and roses and everything is great and you're learning every day, you're progressing every day. Some days you're not doing anything significant. That happens very rarely, but it happens. Yeah, there are days when you kind of hate it, but those days will pass and you will eventually get to a better place. I know that will happen gradually as I progress in residency, get a better hang of everything that is going on. So yeah, this was the first 2 months of my radiology residency currently. I tried my best to share everything that has happened over the last 2 months. I hope I can continue this in the future. I hope I can share both the positive and the negative aspects of whatever I experience, because I feel like I tend to cut out the parts which are bad so that I don't spread any negativity on this channel. But sometimes it is necessary to show both sides of a coin and to give more realistic picture of what things are like. Sometimes we have a certain view of something and it is not like that at all. I hope it can be helpful or motivating or entertaining maybe to all of you out there. Something, one of the above. Thank you for watching this video right now. Sorry for the way I'm looking right now, but I can't help it. I haven't had the time to look after myself really this last week. I'm hoping that I can see you guys again in another vlog and in another video very soon. Thank you for watching. Hope you guys have a good Diwali. That's it from me today. Bye bye.